Oh, I think we'll get started. Welcome everyone. My name's Dipti Prabhu and I'm the executive director here at the Dorothy Lay Hospice. I'm going to be your host and moderator tonight for our exciting session on navigating a life-changing diagnosis, 7 keys for more choice and control. So I want to welcome all of you for joining us tonight, and we're pleased to offer this webinar in partnership with our Mississauga, Ontario Health Team. We're working with Mississauga Health and our partners here in our region to improve access to services for people that have a serious illness and that are palliative and much more earlier in the journey. So thank you for joining us tonight. I'm going to start first with a land acknowledgement. Dorothy Lay Hospice and the communities we serve are located on the traditional lands of several Indigenous nations: the Wendat, the Anishinaabe, the Haudenosaunee, the Métis, and the Mississaugas of the Credit First Nation. The territory is governed by Treaty 13 and the Dish with One Spoon Covenant, which is an ongoing peace agreement between many Indigenous nations to share the land, taking no more than is needed, leaving enough for others, and taking care of the land for generations to come. We acknowledge all who have been displaced by generations of international colonialism, and are grateful for the knowledge keepers and the elders who are with us today, those who have gone before us, and the youth that inspire us for tomorrow. So thank you for joining me in that land acknowledgement. Before we start, I just wanted to have a couple of housekeeping items. First, we'll be recording the session, so hopefully that is okay for everyone. And the format will be a fireside chat or interview style where I'll be asking questions of our authors who are here today about their book, and then they'll be sharing some responses. And that'll be about 40 minutes of the webinar tonight, and after which we'll have a question and answer period with the audience, where audience members will be able to ask questions. And you can send your questions in the chat whenever you have a question. We'll keep track of them and ask them at the end, or you may keep it and then hold on to them and ask it at the end and just put it in the chat. Lastly, we do have free books in terms of our book, the author's books, in terms of Hope for the Best, Plan for the Rest. 7 Keys for Navigating a Life-Challenging Illness, right here, you can see. We have them at the hospice, and it is free to anyone who's interested, who's registered for the webinar. And so you'll receive an email tomorrow if you've registered, with instructions on how you'll be able to pick it up. So finally, we are so pleased to have Dr. Samantha Winemaker and Seow, authors of the book Hope for the Best, Plan for the Rest, 7 Keys to Navigating a Life-Changing Diagnosis, here tonight with us to discuss how people with a serious illness and their families can take more control and be better prepared to navigate the illness experience, and also have hope throughout that process. I have to tell you, I've known Dr. Hsien for a very long time, and I've come to know Dr. Samantha Winemaker, and they're 2 of my favorite people. And I think it's because we're kindred spirits in that we have a shared belief that everyone should have the ability to live with quality of life when they have a serious illness into end of life and beyond. And so I'm really thrilled that they're here today. And I'd like to introduce you more formally. They're not only fabulous people who are funny and bright, but they're also incredibly smart individuals who accomplish quite a lot. So Dr. Sammy Winemaker is a palliative care physician who sees people in their homes. She cares for patients with a serious illness and those that are end of life, and their families in the home. She's an associate clinical professor at McMaster University in the Department of Family Medicine, Division of Palliative Care. She has won numerous awards for her leadership and palliative care education for healthcare professionals, including the 2024 McMaster Palliative Medicine Teaching Award. Congratulations, Sammy. Dr. Hsien Seow is the Canada Research Chair in Palliative Care and Health System Innovation, and a professor in the Department of Oncology at McMaster University. He publishes healthcare research focused on improving the patient and family experience for those facing serious illness. He recently was inducted into the Royal Society of Canada's College of New Scholars, Artists, and Scientists. Congratulations, Hsien. They are the co-host of the podcast Awaiting Revolution, And the co-authors of the book, Hope for the Best, Plan for the Rest, 7 Keys for Navigating a Life-Changing Diagnosis. We are so pleased and so honored to have them here tonight. So we're going to get started, and I'm going to ask the first question. So Sammy and Hsien, if I can, I have to call you that.
Yes,
Yeah,
please.
I was going to
yeah,
say,
please.
we know each other too well. Could you share a bit about yourselves and what inspired you to write this book?
Oh, sure. Do you want me to go, Sian, or do you want to
Well,
go?
I will just say thank you so much for having us tonight. I'm so glad to be here with all of you virtually. Thank you, Dipti, for that beautiful introduction. And of course, Dorothy Lay Hospice, 35 years old or young, and the oldest hospice, but really a champion. And it was Dipti's, ingenuity to find a way to get all these books for your community and to pass them out. So I really appreciate that, so that we can really talk about what it means and not feel like we're you have to buy something at the end to learn something. So thank you. Do you want to share your stories first, Sam?
Well, you're doing such a good job.
All right. Well, very brief. I mean, I'll just give you our story. My story actually starts with this. This is my mother right here in this corner. Did you may not know? That's my mother. She was a beautiful person, but she got breast cancer when I was young. And for those 4 years when we were going through that journey, my whole family, we didn't really know what to expect. And even when it came back and she was getting frailer, we just didn't really know what it all meant. And we felt lost. We did not have a palliative care team to help us. But it wasn't so much about whether we had access to a hospice. It was really just that whole time we didn't realize it was her last chapter of life. And I got into this field because I was trying to make a difference through research, but I kept hearing the same story, just like mine over 30 years ago. So I think Sammy and I got together because we wanted to find ways to make a difference. We do work through policy research and writing articles and teaching clinicians, but there had to be another way we felt because we keep feeling, in fact, it's not even that we keep hearing the same story. I feel like it's getting worse in a way. I mean, there's less money and more pressure. We have got to come up with a different way. Uh, and I think that we've come up with some ideas.
Hmm. Um, and
Thank
yeah,
you. Yeah,
I have
Sammy.
a little bit of a different story, but same theme. As you mentioned, Dipti, I work in people's homes, and I've been working for about 20 years. And, for the first years, I felt so good about, the work that I did and so helpful, and thought, okay, well, this is just fantastic. And it is fantastic, except that the same themes kept bubbling up over and over and over again. The same scenarios of people feeling like they didn't really have a good grasp of where they were at in their illness and what to expect going forward. And I spent a lot of time helping people to understand that, um, and realized that, these people are at the end of what is sometimes a journey that has lasted years, and they have had multiple touch points with various healthcare providers. So why at the end are they so confused about what's going on? And so what began as a feel-good career started to feel like I was cleaning up the problems of the healthcare system, one house at a time. And so with my frustration and Cien's frustration, it was like a perfect collision of two frustrated people. And that's the truth.
Yeah.
Well, I join you in that frustration,
Great. That's why we're kindred spirits.
having worked in palliative care for over 20 years myself, and I think many healthcare providers, Sammy, Hsien, can relate to your story. We've seen that, we've heard that. Many families who've experienced the system will tell you the same thing. So thank you for that. Tell me a little bit about, you call the title of your book is called Hope for the Best, Plan for the Rest.
Mhm.
Can you elaborate a bit on the philosophy behind that title and why it's important for individuals and families facing a life-changing diagnosis?
Yeah, sure. So we wanted to make sure that whatever product we came up with for the citizens of the world, that it didn't seem doom and gloomy. Um, we wanted to come up with some very practical guidebook almost that would help people through their journey. And so after many years and many cups of coffee and many titles later, we came up with this title. Um, and we wanted it to be approachable. And hope for the best, plan for the rest really comes from, this acknowledgement that people's natural style when someone is facing a serious illness is to become almost like cheerleading around them. And we become uber hopeful. Families, healthcare providers, we just want to say, stay positive and fight this battle and you can do it, stiff upper lip, stay positive. And that can feel silencing to people and prevent people from actually doing that other hard work of planning for the rest. And so in our book, we talk about walking two roads, which we might get to later. And it's really this idea that human beings are incredible. We can both be hopeful and plan for the rest at the same time. That just because we entertain the what ifs or the realities and truth of the illness as things change, that doesn't dishonor people's hope. In fact, it allows hope to evolve over the illness course. So, yeah, we wanted to have something that was very hopeful.
Great, thank you. And I reflect on even hospice philosophy and perspective. It's the same thing. It's about hope for today, for this moment, and what that could be, even as the individual is facing end of life. And so this notion of hope coexisting at the same time as someone's experiencing illness and different parts of illness, I think it is really, really important. So you talk about, walking two rows, and that's one of the keys. So let's talk about the seven keys. Could you talk a bit about the seven keys? Which ones do you think are most important for people to consider? And yes, if you could share a little bit more about the keys, that'll be great.
So I'll just add that before we can dive into them just really quickly. But I was, the seven keys are really a set of seven actions. And the whole thing that it took us a long time to really figure out was we're experts at really the end of life. But while we were looking at what worked well at the end of life, we realized that there were seven actions that people could do that made them more in the know. They were more prepared, more in control. And they did not we need to wait till some point in time when they were told that they only have 3 months or 6 months or something. They could do that right at the beginning. So while we're experts at sort of maybe the end, we actually learned these keys could be useful to make the whole, anybody who's interfacing with the healthcare system, they need to be prepared and be an advocate. And so in a way, this book, Hope for the Best, is about learning how to be a patient, how to be a caregiver when you get that label. And it showed, yeah, and we learned that from people who we met who didn't do those, and we called them in the dark. They were sort of frustrated, overwhelmed, but there were some good stories that that we knew from my research and Sammy's uh, thousands of people that she's helped care for, that they were more in control and had more choice. So that's the seven keys. It's really the secret, I guess, if you will, for lack of a better word. They're keys to unlock a better illness experience. And we wanted people to learn how to do them and that they didn't need permission from the healthcare system to do it. That's really the exciting part is these are sort of like mindsets that everyone listening can do tomorrow and they will change their experience. And that's what we've heard. So Sammy talked about walk two roads. So do you want to do zoom out? I know it's your favorite one, I feel like.
Sure. Because you normally do walk two roads, so we've been thrown off our usual mojo. Okay, so the second key is called zoom out. And zoom out is this idea that every illness has a roadmap, a footprint, or a storyline. So even though a person with a diagnosis is getting that diagnosis for the first time and it feels very unique, billions of people have had that specific illness before them. And so it's well mapped out. And we get so busy in the nitty-gritty daily grind of the illness stuff, appointments and tests and results, that sometimes, well, a lot of the time, people aren't offered or don't know to ask about what's the big picture of this illness. So we teach people in the book how to extract, like rise up out of the rabbit holes and extract this really beautiful roadmap. So zoom out and find the language, which we give you, to ask about what this illness looks like generally over time. What's the beginning, the middle, the late, and the end look like? What are the milestones that I need to know about and the decision points? That stuff is so important. It's such important scaffolding that I tend to think, how can anyone go through an illness with just being in the nitty-gritty without this roadmap? If you think about going on a hike, you would never just enter the forest without a roadmap. So every illness has a roadmap. So we teach people how to zoom out.
Yeah. There is a key. I don't know how much you want to go into this because it's on the book, but the third key is about know your style. And it is this idea that we sort of think that the illness will, whatever illness you get, will, or the kind of doctor that you meet, that is going to dictate the story, your journey. But in fact, how you yourself as a person, and frankly, your inner crew around you, your chosen family or your inner crew, have dealt with challenges in the past, that's gonna have a bigger effect on how the story is gonna unfold. So your tendencies, your habits, those are really gonna, in a way, amplify when you face challenges like a serious illness. And so leaning into that, being aware of that, being proactive about that, helping, uh, thinking about I'm this way, so what am I gonna do to balance that, or vice versa? What can my chosen family help me do so that I don't get into those situations? That's how you can take back control of your illness story.
Yeah, I think that's really great. I think what you both said, I think the whole idea of zooming out, Sammy, really, and all of us, it happens to all of us, whether you're going through an illness or you're going for a stressful situation or challenging situation, you tend to be in the weeds, and struggle a lot with the weeds. And it's really painful and difficult, and it's hard to kind of see out beyond that. But the ability to kind of, step away and think about the bigger picture, I think it's really helpful advice. I think not just for dealing with a, serious illness, but also any kind of really life challenge. So I think that I found that very helpful in the book. Is some of what you're talking about, I think, is very helpful in general in terms of how to deal with stressful, challenging, situations in one's life. So I found that particularly helpful. And I think what you've talked about, Hsien, just now around knowing yourself and having that self-awareness of what your tendency are. How do you cope with things? How do you manage? Are you somebody who keeps things to yourself, or do you want your family involved? Or, what are some of the ways that you manage, and putting that lens on your illness experience will help you plan a bit better for, how best to respond as well. So I thought that those two pieces, I think, are really, really important for people. And I love the fact that in your book, you give practical tips on how to do that. Do you want to talk maybe about one or two of those practical tips for people, whether it's zooming out or knowing yourself a little bit more, or any of the 7 keys?
Yeah. Well, there's one other key there's 7 of them. There's one called customize your order, and that's a little bit like know your style. These two are this idea that people don't want to be treated as if they are just another patient. They don't want to be lumped into the category of just general. Each of us wants to and deserves to feel and to receive an individualized, unique interaction with the healthcare system. So know your style and customize your order are both about really being mindful and reflective of who you are, what's most important to you, what you hold dear and near to your heart, and some of your style, and learning how to bring that forward to every healthcare interaction that you have so that you sidestep or avoid being lumped in as just one of the general. So in one of the skills we talk about is listing your values and what you hold dear to your heart, and almost using those things as a reminder every time you come to the healthcare system, how you can present that to, I'll just always pick on doctors, to the doctors that you might be dealing with, so that they treat you like a unique person.
Yeah, and I was just gonna say, like, besides our book, we have a podcast, but we also have a website, waitingroomrevolution.com,
Mhm.
and we have some free tools on there. And one of those tools that you can download is this thing called Ask Me the Right Questions. And on that, we put 5 questions that we thought patients could ask their healthcare team. And frankly, I think this is a little bit off script, but I think I can show it here. Like, this is the tool. It says, "Help me ask the right questions." And it's a one pager. It was in collaboration with Health Canada. And really this is an example of like a helpful tool or a question you can ask, like, where are we now in the big picture of this illness? What can we do now to be as well as possible? What are some common signs of this illness worsening? Things to prepare for next, and organizations and resources that can support us, like Dorothy Lay Hospice, because we have community programs and lots of people don't know. So these are questions you can ask your healthcare team early or right away, because you really should know these. They're all relevant for right now, not just, days or weeks before, someone passes away, when they're very sick. So anyway, this is an example of the kinds of questions we have in the book, very practical, simple, and we have heard from people that very useful in changing the conversation with their clinical team and helping them get sort of unstuck in this circle of where they're at and nobody wants to talk about it, or feeling like there's this veil of secrecy. But these questions are broad enough that they allow people to find their space in them. So we're not forcing information on people. We're inviting them to know as much as they want, or to let them know that there is information to be had that
Mhm.
might be helpful.
Mhm.
It's wonderful. So we put it's called waitingroomrevolution.com. So that's the website that Sammy and Hsien are referring to. There's lots of resources and tools, and they've got their Waiting Room Revolution podcast. There are several podcasts. I happen to be a guest in the spring, and you'll learn even more information there. I think the other, you talked about knowing your style, knowing more about yourself, what's important, your values, and being able to bring that to interactions or conversations you have with the healthcare system and providers. You also have a key that talks about invite yourself, and can you talk a little bit about that? Because I think that that's important in terms of patients and families being really empowered to invite themselves into the conversation.
Yeah, so invite yourself. All right. So many people, and it depends maybe on what generation you're from, but I can think of certain generations where, you know, they think that if they come to the healthcare system, very polite, clean, clean dressed, quiet, and just, shrink, that they're going to get better care. Because things seem to go more smoothly when you are sitting there sort of in a passive way. But the truth is, news bulletin is you don't get what you need when you are a more passive, laid back, quiet, good patient. Good patients get nowhere. And I'm being a little bit cheeky, but um, invite yourself is about learning how passive am I naturally versus how assertive am I, um, or am I an aggressive person, and figuring out how can I be more respectfully assertive in my illness journey and therefore get what I need. It's like finding your voice. It's like saying, move from the back seat of your illness journey into the front seat, either driving it or be in the seat beside it. But we don't want to take this, doctor knows best. I'm just going to be a good patient. You will then get standard care. Standard care is good for most people, but not everyone. And most people want me care, not everyone else care. So invite yourself is about finding your voice and, sitting up straight and being respectfully assertive. What's the other term, Hsien, that someone used? Fiercely,
Gently fierce.
Gently fierce. I like that too. So it's
Yeah.
not about being aggressive and, causing a big hoo-ha, but there is a way to be gently fierce.
Yes, I love that. Gently fierce, gently assertive too. I mean, those are
Yeah.
those
Yeah.
are great words. The other, so I think you talk a lot about individuals and knowing themselves and inviting themselves. Can you talk a little bit about caregivers and families and how they might support? What role can they play? What can they take away from your book that will help them assist their loved ones?
Yeah. I mean, it's written, when we were thinking about all this for several years, we could have written the whole book to caregivers. We wrote it directly to the patients, but we believe it's really to both of them. It's to patients and families, and I say families because there are caregivers, a designated role, but there's always more this ripple effect of everyone who's affected. In fact, that's one of the keys. Anticipate the ripple effect, and caregivers and families, do 90% of the care outside of hospital, and the community is supporting them. So we believe that all the seven keys apply for, caregivers and families as well. The more that everyone is in the know, asking the questions on the same page, the more I would say, yeah, the journey it will still have bumps, but you'll be more prepared for them. And
Mhm.
so walking two roads, knowing your style, zooming out, these are things that families or caregivers should do, can do, and frankly, sometimes they are the ones taking the lead because sometimes patients may be too weak or tired to do it. So a lot of the burden, pressure to ask the questions and do the planning is on families. So these one all apply, and we are trying to activate, give the language to patients, families, caregivers, and also healthcare providers on on the other side, so that we can meet in the middle and have different conversations that don't that we're scared to talk about, or they didn't ask any questions, so I guess they don't want to know. No, no, we want to offer that there is information about what to expect, what's going to happen, what is likely going to happen, things that you may want to think about because we've seen this before. And if you want to know about that, I can tell you. And if you're not sure you're ready, like that's okay too, but maybe next time. So caregivers are for sure a key piece of this. They would sub out all the words that we have special activities or exercises for them. But I think we know that sometimes people don't even know that there is label of caregivers. They don't identify with that term, and so we really just think this is families that are they're along for the journey. They're sort of on a parallel illness journey, and so we don't take that lightly, and we really try to highlight the kinds of questions they should ask and things they should think about for themselves so they don't burn out.
And as I think as you're talking about families and caregivers, I think a lot of these things, well, it can apply to the individual, it can apply to the family and the caregiver. So what's important to the family? What's important to the caregiver? How do they zoom out and not just think about the day to day? Because caregiving and families who are involved in this, it is really difficult too. And it can be challenging. And so your keys, I think, can apply to that broader lens of the family and the caregivers and their experience that they're going through as well.
Mhm.
Sammy, you talked about invite yourself and talked about being gently fierce. And tell me, in your experience, as you now had your book out for a bit of time, and I know many people are reading them, and it's making quite a difference. We actually, when we were promoting our this webinar, we got feedback that somebody recently was given a life-changing diagnosis and got this book, and it's already helping this individual. So that's really wonderful. Tell me what the experience has been or feedback has been when patients and families do invite themselves and are gently fierce with the healthcare, their doctor or others in the healthcare system. What's been the reaction?
Yeah, okay. This is well, I'd like to say, oh, it's perfect. It's working perfectly, Dipti, and period. That's all they need. Okay. The truth is that we have set like the citizens of the world to go forward to the healthcare system with a new mojo, right? After reading the book. Patients and families love the book. We get lots of feedback, which is so amazing, so affirming that these seven themes that we, you know, extracted from our data and our stories are so relevant to so many people. The problem is that we have not changed the healthcare system yet. And so we have set people forward with a new energy. And that's what we wanted, right? We wanted a groundswell of new patients and families so that the healthcare system is like, what's going on here? I think I think we need to do things differently because the patients and families are not the same as they used to be. They're asking us to zoom out. They're asking us, the rest. They want us to connect the dots. Like I don't even know where this language came from. So I think as individual people, you would feel empowered after reading the book. As an individual person going to the healthcare system, depending on who you land, it might go well, it might be a challenge. And the reason is because, believe it or not, and you would know this, Dipti, this is not part of nursing curriculum. It's not part of medical curriculum. And so we graduate a whole pile of healthcare providers that, by the time you're done your training, you assume you can basically fix everything. And if you can't fix something or cure something, it's like you've done something wrong. So we know now that we are responsible, Hsien and I, and Dipti, you're in this too, uh, to go back with this new language that we've created, these 7 keys, and reconfigure them for healthcare providers. Because we want people to be successful when they go forward and ask about walking 2 roads or zooming out, or I want to tell you my style, or I'd like to customize my order. We don't want to set them up for failure. So we have a huge responsibility, and we're in the middle of figuring that out, and we're getting somewhere on a product that is a companion to this citizen-facing book that is going to be for healthcare providers. So I think change takes time, and I hope that enough patients are getting this, thanks to people like you giving the book out to all these people, that enough people come to the healthcare system that no one person will feel like they are a thorn in the healthcare side. That if we all do this together, it is part of a social movement that we can put, gentle pressure on the system to change. But we are taking responsibility for part of that change as well. And we're creating tools for healthcare providers. That was a long answer.
No, that's wonderful. I think that's amazing. And I share your commitment to this. It is, you call it your podcast, a waiting room revolution. It is a revolution.
Yeah.
It's a revolution to change our healthcare system from being so focused on just treating and acute. Not that that's not important. It's so important. We all have a heart attack. We need acute care. We want that. But to really refocus the system, particularly as it relates to serious illness and life-changing illnesses, to be able to shift the way we care for people that's focused more on truly understanding what's important to them and supporting them and their loved ones through that process, just as your 7 keys describe. And so I'm 100%, we're fully aligned on that.
Yeah,
And,
I know we are.
we that is our goal and vision, even here at the hospice, is to educate the public and our
Yeah.
community that that's important. And that's the essence of hospice palliative care as well. Um, you have 7 keys, and Sammy, I know you're out every day seeing people in their homes. Can you share some practical examples and I know, Hsien, you've talked to many people who read your book and are starting to apply this. Can you share some practical examples or anecdotes that illustrate how these keys have made a difference for individuals and families you've worked with? I know I shared one just recently about a person who's listening today and how the book has helped them.
Yeah, if I'll just say that one of the things that we were pleasantly surprised with is that healthcare providers can also be patients and families, or can also be, listeners of podcasts and books, and they've read this or listened and said, "Wow, I can I want to practice care in a different way. And this opened my eyes to some of the things they didn't realize from a patient perspective of what they thought. You know, they sort of thought, oh, if patients sort of don't have questions, then they're happy to not know and they don't want to know about the future. But so many patients say we want to be not to be prepared and not overwhelmed. And so it has been a pleasant surprise that, not uh, those who have read it appreciate it, want to use it, and can while patients can ask the questions, providers can invite people to know more. And so that has been one thing that has been, sort of the reaction that we've had. And I've heard from providers in my cancer center, for example, that patients give them the book or they read it, and it has changed the way their conversations are because they realize it shows that the patients are and families are thinking about these things. So they've sort of broken the ice and they aren't talking about death and dying. They're talking about what's important to them. They're talking about how to prepare, how to be as hopeful as they can. And they realize that by preparing and planning ahead or just understanding where they are in their illness, sometimes they think they're at the end, but they're really not. There's a lot of things that can be done. That is also affirming. So that has allowed them confidence and to want to have those conversations and not be afraid of them. So I think that is one thing. And the other story I wanted to share, and then I'll pass it to Sammy, is we get this question a lot that, well, mom or dad, who has an illness, like they don't want to talk about it. Every time we want to bring it up there, they just they would say they're in denial. But in a way, that's just how they process information and they understand they have an illness, so they're not really in denial. They just don't want to talk about dying. But when they read the book, they have highlighted it and flagged, bookmarked it. And the next time they go to the appointments, they have found questions to ask. So it has like given them a language so that they don't have to feel like I don't know what to ask, I don't know what to say. It's given them some options, and we give little scripts and prompts to 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 sort of build the bridge, if you will, the steps, so that they can get as much information as they're ready for at the right time without sort of feeling like it's all or nothing.
Mm-hmm.
Thank you, Hsien. Sammy, your thoughts?
Yeah, I've had a lot of people say to me that um, what completely changed the interaction with their healthcare provider was when they went and said, um, I'll just pick on doctors again. Doctor, you have my permission. You have our permission to speak openly to us. And so please don't sugarcoat things. Um, and so we are helping people with the languages, the catchy phrases that are going to get them what they want. There's one gentleman who we know who took piece of paper and crayons and went to his doctor and said, I'm hoping that today we can draw on this piece of paper what my illness is going to look like. And he and his doctor got into this whole discussion about, and it doesn't matter what the drawing looked like, but the crayon and the paper got them talking about, things that the doctor would have been more likely to say, oh, just let's stay positive, or I have no crystal ball. No one really knows. Everyone's so different. These kinds of responses are not helpful. And so we have to almost like help the doctors realize they have a lot more information um, than they realize. I wanted to also mention that no healthcare provider goes into this field of work thinking they're going to fool people or, be dishonest or neglect important information. People go into this care because they truly want to have a relationship, a therapeutic relationship with patients and families. But most unfortunately, this healthcare system has a way of dehumanizing patients and families and dehumanizing healthcare providers. So much of the behavior that we see is a suffering healthcare worker force, and suffering patients and families. This kind of permission we're giving people is to really put the human back into the patient and the family side of the equation and the healthcare provider side of the equation so that care doesn't feel so transactional and robotic, and that it can feel more relational. And so I hate to say it, but we've become huge narcissists, and we believe that this is going to change the entire healthcare system, Dipti.
Well, I'm with you. I'm with you. I don't think it's narcissist. I think we're dreamers, and we believe deeply that this is the kind of movement, as you said, social movement and cultural change we need. And I think, Sammy, you was going to ask that question around healthcare providers. 100% agree with you. Everybody I've met in healthcare and do this work because they really want to make a difference to
Yeah,
patients and help. Like the simple
yeah,
answer is, I went into healthcare because I want to help people. It's true.
yeah,
Yeah.
And I think you're 100% right as you talked about how I don't think it's the fault of the people, of the
yeah.
providers. I think it's their system, the way it's organized, what it rewards and doesn't reward
Yes,
and all those things.
exactly.
And I think it is a change. And so, one of the, feedback that I often get in terms of why some providers may not do this is because they don't have the time. It's not just they don't have, I mean, some of it is, you're right, as you talked about, not having the skills and the words and the training of how to have these conversations. But and for some, it might be that they're so focused on the acute treatment side. But some say, you know what, I'd love to do this. I just don't have time in my office, like a busy family doctor with so many patients. They just don't have time. What do you say to that individual? How would we support that, family doctor as an example?
Okay, well, it is true that when we avoid these conversations, um, our office will be derailed if we wait to the 11th hour to suddenly begin opening up this can of worms. So I would say to that healthcare provider that doing little bits of this peppered into the entire illness journey will actually save time in the long run. Everyone is pressured with time, but the answer is to lean in and to be brave and to invite these conversations, because the earlier we start, the more likely we're going to be able to avoid middle of the night calls, crisis kind of rhythm to our care, reactive kinds of tests being ordered, and wasteful things happening. This is a time saver. And on the narcissist note, we actually think it is good for the environment because it's going to save global warming, because people will make choices probably for less tests and less intervention and less noise around them. I'm only kidding, really, not really. But anyway,
I agree with you. I think it's not just good for the environment. I think, we talk about our healthcare system and the increasing cost in our
yes,
healthcare system. And, we believe that those of us in palliative care, we know that when individuals and families are empowered with information about their illness and understanding what's important to them, they may make different choices
yeah.
Mhm.
currently do because they don't have that information right now and things are very, very reactive. So
Mhm.
I 100% agree with you. So we've used, Sammy and Hsien, you've used the words, social movement, revolution. I believe this is revolutionary. Can you talk a little bit about, so I'm on your bandwagon. I'm your, cheerleader and fierce champion here.
Oh,
Um,
you're on the executive.
Okay, yes,
Don't
but
know it.
drank the Kool-Aid twice over. But tell the audience who's joined us tonight, if people wanted to join this revolution, what could they do? What could the people on this
Yeah.
on the
Yeah.
on the call do today?
Thank you so much. So obviously, we invite you to reach out to Dorothy Lay Hospice, pick up your copy of the book. They've purchased copies for their community, which is amazing. The podcast called The Waiting Room Revolution, we started that as just an experiment to just sort of get our ideas out. And in season one, we talk about the seven keys. So if you have friends who, aren't able to get the book, it's at the libraries, but want a different format, you can direct them to the podcast. Season one talks about the seven keys in our story. And then after that, it has just grown and grown. We are now in season nine. We have over 150,000 downloads. We're listened to in 100 countries. Who would have known? So it is a social movement from around the world. You can go on our website, waitingroomrevolution.com. It has all the things. We have free tools, those worksheets that we've been working on with Health Canada of questions to ask. We've been making roadmaps about some of the diseases. So COPD, Alzheimer's. So, that zoom out where am I in the beginning, middle, late stage? We have created some tools with clinicians and Alzheimer's Society, et cetera, to help make those discussions easier so people can get more information. So there are many things that people can do. They can tell their friends. We have a workbook coming out. We're so excited. You'll be, Dorothy Lay will be one to be testing it out, but workbook that could lead communities to get together and go through. So you're not just reading the book and sort of asking the questions, but working through some activities that you can use again to change the interaction. So all of this, and going back to that comment about healthcare, um, how people get into healthcare because they want to be caring. I think that's what patients and families who are frustrated can feel hopeful for, because if they can break through that noise and really connect with their providers, those caring providers, they will be able to have that authentic relationship, that relational care that they want, because they'll be saying we're activated, we're asking our questions, they're ready to think and work with us, is what you're really saying to your healthcare provider. Not I'm not ready to do anything and I want you to have all the answers, which is a different setup. Nobody's saying that, but that's the underlying power dynamic that has happened. So we're really trying to flatten that power dynamic, let people know that they do have control of their story. And yeah, the revolution, you can sign up for our listserv. We have a map project now that's trying to map out where all the people are so we can come together as a community and have one united voice, because we do believe that things will change when patients and families come to the system differently.
Great, thank you. And I'm going to ask if anybody has any questions in the audience, and please put it in the chat, and we will ask that question. I don't have any at the moment, but if you do, we're ready to take those questions now. Actually, there is a question in the chat. I'm just going to open that up. So the question is, thank you. I'm enjoying the dialogue. You mentioned training the healthcare providers about how to navigate this line of questions from patients and families. Are you also engaging with political leaders and decision makers?
Well, I would say that, Dipti and Dorothy Lay are like decision makers. They're local decision makers. So we have worked with Ontario Health West and hospices and churches. So in the community, which is where 90% of the care is, where we think they have the strongest connections with patients and families, we are absolutely doing that. As a researcher, Sammy and I are writing grants to the cancer system, to the hospitals. And of course, we partnered with Health Canada to create roadmaps and such. So we are in certain ways, but we also are working with the system of what they can fund, the rules of the game. And so we're trying to play by the rules of the game, but in a way, this revolution is trying to change the rules and take back some of this power that patients' families have and make our own rules. Because if we only play by the rules, we are just going to keep getting the same thing. So we're taking advantage where we can, leveraging our partnerships, which are so important, trying to find the right collaborators, ambassadors of the revolution. But we are also not afraid to say we are going to come and really go direct to patients' families and say, no, you can ask these questions. You can find this information. They do know, and you can find a voice. So we are trying. Go ahead.
Hsien and I have popped the book in the mail to key individuals. We haven't heard back, but politicians and things like that. So we are trying, but that is really essentially where we started, sort of trying to change the system. Part of our original story was that Hsien and I found each other on a committee long time ago, a very frustrating committee, one that we both joined because we thought that we were really going to change the system. This committee was going to be the moment that we were going to have, and we couldn't get anywhere. And so part of our frustration of seeing the same stories over and over again, really much of our frustration is we didn't seem to be able to get anywhere with the system. So we are trying to get somewhere with patients and families and soon to be healthcare providers. And we're hoping that that base will force something to change with the system. If anyone has any good ideas or connections where we could, infiltrate, decision makers or thought leaders, etc., we would be happy to follow any leads for sure. But the biggest bang for their buck right now is with the citizens.
Yeah. And I just wanted to add to that. I think it's about going at this from all angles, right?
Yeah.
And I think for many, many years, you're right. always concentrated on trying to make the system, from the system point, healthcare system better with providers. And then I think there's huge power in empowering patients and families because A, it helps them there now in the moment as they're going through illness, but there's power in that voice of patients and families, and that's the revolution. If you have enough
Yeah.
patients and families demanding a different healthcare system, I think that holds a lot of power.
Mm.
Um, and so I think that's great. And I think at the same time, as you said, Hsien and Sammy, that's our partnership. And all of us in the healthcare system, whatever we can do to champion this at many levels, including, government officials, healthcare officials like Ministry of Health and Ontario Health and others, we will do. This we've embraced it here as part of our Ontario Health team, and we're going to, spread the word. And I think that is important too to ensure that we're looking at all the various structures that exist in our system. So I think that's great. I'm just going to see if anybody else has any more questions. There's another question here. This is a question that's from Carrie Johnston, and Carrie is asking, as a retired critical care nurse, oops, sorry about that. Oh, my apologies. Critical care nurse who has helped many family members and friends through end-of-life care. This kind of thing is so
Yeah.
needed.
Oh, yeah. Thank you, Carrie.
It's it's so interesting how different care settings, um, you know, feel the need for this kind of truth being peppered into what happens at the bedside. And the ICU definitely is one place where, um, you know, I agree with Carrie that this is needed for sure. Same with the emergency room, same, with everywhere. So thank you, Carrie, and thank you for your work.
And Alexandra asks, no question. She just wanted to say that this was fantastic. It matches so many of her experiences. She's a healthcare provider in the emergency room OT, and also the personal journey she's had with her loved ones. So she just wanted
Yeah.
to
Oh,
say
thank
that.
you.
So you know what? We could say welcome to the revolution to every single person, right? Who has joined this particular event this evening, and to, Dr. Greenhill and to Carrie for, these reflections. That makes you part of this social movement. And that's all it takes, is just sort of an awakening. And we're not going to get tons more money or tons more people in the workforce, or, illnesses are not going to disappear tomorrow. But what we can do is take some control back, and we can definitely improve our illness experience and other people's illness experience for sure. That's the good news. It's just a change of mindset.
Carries in, which is fantastic
Oh,
in
good.
evolution, which is great. And Joan says, have you considered reaching out to seniors groups? I think the starting point is with the patient.
Oh, yes. Are you kidding? Anyone and everyone who wants us to come, we're happy to reach out to absolutely anyone. For sure, seniors. And like I said, I think we're really beginning to appreciate that different generations have a different relationship with their health and the healthcare providers and the system. And we can easily adapt these messages to the different generations. So seniors are hugely important and hugely invested. We have such a huge cohort of seniors, and many so marginalized, and silenced. So really important group.
Thank you, Joan, for that. We've got Christine who says, thank you so much for this webinar. I was lost during my mother's end-of-life care, and I'm a pharmacy technician in a rehab hospital. I can bring this revolution to my father's Alzheimer's diagnosis and illness experience now. Thank you.
Yeah,
Yeah.
on our website, waitingroomrevolution.com, there is a roadmap for Alzheimer's that we've created with the Alzheimer's Society. So specific to that one, you can go in the resources and check that out. And hopefully that asks you some questions, things to think about. And we're working through some of the other illnesses like ALS, cancer now, and so on and so forth. But all of the questions, sorry, all of the illnesses, the generic questions are in the book. So make sure you check out that copy, because I think that was one of the ways that was an easy way to get this information out to many people. So yeah, we really appreciate people who can see themselves in this work, because it isn't about me and Sammy. we just sort of were the catalyst and just frustrated enough to be the face or the start of it, the spark, but we won't see change if it's just the two of us. We need all of us to think of the ways that we can change our individual experiences or how we think about our role in the system. If we can empower patients and families with more information earlier, that's how we'll save the system time, that they've
Mhm.
come already ready with an advanced care plan or an advanced care planning document, or having thought of what's important to them and keep saying, I don't need all that stuff. This is what is important to me. How is everything you're going to say going to help me do that? That's going to change the conversation. Otherwise, they don't know what they should be working with you, not you for them. So yeah,
And I think people are looking for your contact information. I think we can reach it, I think we can reach, people can reach you, Sammy and Hsien, through your website, right? There's some
yes,
contact information
Yeah.
there. So, and
exactly.
absolutely reach out to us at the hospice too. We'll be happy to assist you as well. And so I'm recognizing it's 7:29. I don't think there's any more, oh, Ron C says, thank you for showing us how to be gently fierce. I love
Yeah.
that term as well, gently
Yeah.
fierce. Thank you. So as we're getting to the close, oh, I'm going to read Tammy's comment too. Tammy said, thank you. I work at the Ridley Funeral Home, and your efforts really help with language that encourages connection, both for people who have received a diagnosis and for the end-of-life professional. Information is empowering.
You know,
Absolutely, Tammy.
that,
Information is
that,
very empowering.
that is so the bottom line, really, is that information is the superpower, for better or worse. You can't have too much information. It really is what is the secret to having a more in control, grounded illness journey that doesn't feel like you're on a roller coaster the whole time. So thank you for that. Information is empowering for sure.
And I think Sammy and Cindy talked about it and how people can help. And I think the ways people can help are just spread the word. Spread the word about the book, what you know, what you've learned. Even one, key or what a little bit of information is helpful to people. And I see that happening organically, that people read the book and then pass it along to someone they know or a neighbor or ask. The other thing I would say to people is that, the hospice is here. We don't take care of people just at the end of life. We help people right from a diagnosis of a serious illness, and we can assist you. If you have questions about the 7 keys or how any support you might need to kind of navigate, just give us a call and we will help you with that as well. And so with that, I don't see any more questions. Oh,
There is a question about whether or not you have taped this session and if it would
oh.
be available online.
Yes. So we have taped this session and we will make it available on our website or at least send it out also to the participants. And as I've said, we have books here that we are able to provide to people, to everyone who registered. So if you're interested, you'll receive an email and you can then come pick up the book here at the hospice. John D says, from one winemaker to another, thank you for being evangelist in this topic. Thank you so much for all this. The book and this has provided me with the courage to move ahead when speaking with doctors. That is so wonderful, Nina. We're so happy that that this has helped you.
Mhm.
So it's 7:32. I want to say to the audience, thank you for joining us tonight. I think from what I'm hearing in the chat, many of you have also drunk the Kool-Aid and are going to join this incredible revolution. I want to thank our authors tonight, Dr. Hsien Seow and Dr. Sammy Winemaker, for joining us. I want to thank them for creating this beautiful book and this beautiful movement. Honestly, you're not narcissist. I think you're heroes and you're so courageous to move forward in trying to change the system. So thank you so much for joining us tonight. Thank you again to our Mississauga Health Ontario Health team for supporting us and putting this on. We're going to have many more sessions like this over the next year. And so we encourage people to spread the word. So with that, I want to thank everybody who's joined us tonight. Please do reach out to us at the hospice if we can help you. And please, we have books. We have lots of them. So please reach out and we'll be happy to provide you with a book as well.
Thank you, Dipti.
Thank you all so much. Have a really good rest of the evening.
You
You
too.
too.
Thank
Bye-bye,
you.
everyone.
Bye.